Greetings, Porter County, and welcome to yet another edition of the PoCo Wellness Hour, right here on WVLP 103.1 FM, your voice for local community radio and your show for health, community connection, and overall well-being. I'm your host, Demetrius Lewis, Communications Manager with the Porter County Health Department. Now, if you're not familiar with the PoCo Wellness Hour, this is an opportunity for us to shine a spotlight on the incredible health initiatives shaping our community and the powerful partnerships that make it all possible. From local organizations working to improve public health to the innovative programs led by the Porter County Health Department, this show is your guide to stay informed, inspired, and engaged on your wellness journey. So sit back and relax. We hope you enjoy today's conversation. Now, today we have a few special guests joining us, and I'll get to introducing them here in a few seconds. But first, from May 6th to May 12th, it is celebrated as National Nurses Week. This week is an opportunity for us to recognize the important role and the contributions that nurses play in our community. The theme for this year, the power of nursing. With that being said, I'd like to introduce three of Porter County Health Department's three biggest rock stars, three women who I say fit this theme. I would say they've got the power. So, I'd like to introduce you to Nurse Shannon, Nurse Haley, and Nurse Amy. Ladies, how are you today?
Doing well. Good.
You didn't know I was going to sing to you today, did you?
No, that's great.
So let's get this thing going, guys. Okay, let's get into it. So, of course, just like doctors have specialties in certain areas of interest, the same thing can be said about nursing, too. So, I'd like to take this opportunity for you all to introduce yourselves and talk a little bit about your role with the health department and what specialties you guys specialize in. Let's start with you, Nurse Shannon.
Well, my name is Shannon. I've been with the health department a little over a year. I am the communicable disease coordinator, so any of the reportable diseases mandated by the state of Indiana that are required to be reported to the state get filtered back to me at the county level. I'm responsible for investigating those diseases. Can range anything from salmonella to Lyme disease to hepatitis C, but each of those diseases get kicked back to me if the patient lives in our county, and so it's my job to investigate those, get a hold of the provider, get additional information, contact the patient, make sure that they're sticking with their treatment plan, that they have access to the providers that they need for that treatment, and then just to follow up with any questions to see if we might be able to track down where they may have gotten the disease from. So I report all of that information then back down to the state, and then they take a look at that and determine whether or not it needs to be escalated to possibly the CDC or the FDA if it's a food issue, and then they, like I said, take it from there and determine if it's something that they deem to be a risk to the more of the community or public in general.
Awesome. What about you, Nurse Haley? Talk a little bit about your role.
Hi, I'm Haley. I run the Fetal Infant Mortality Review Program in Porter County, and I look at all of the fetal and infant deaths from 20 weeks gestation to 1 year of age. I review all of the medical records for these individuals, and our primary purpose and goal is to create healthy babies, mothers, and families within our community. We look for gaps in services provided and try to accommodate our community to the needs that best suit our public.
Very important role. Very. What about you, Nurse Amy?
So hi, my name is Amy. I'm a little over 2 years into my career here at the health department, and I specialize in HIV and STI care coordination. And what that means essentially is anybody who comes in and is willing to share their story and any concerns that they have, we test them, and then if they need treatment, I'm the one who can hook them up with those resources, be that local I can provide immediate care in-house, or if they need a bit more extensive or more resources than what I can provide at the county, I get them state and national resources too, with different organizations like the Aliveness Project of Northwest Indiana, as well as the disease intervention specialists, my absolute superheroes who work out of the Gary Health Department. And I talk with all kinds of people from the state down to just my next door neighbors about what their needs are to protect all of Porter County. And as long as you're a resident here, I get to take care of you.
3 important roles from 3 important ladies in our community. Can you share a little bit about your journey into nursing and what specifically drew each of you to the Porter County Health Department? We start with you, Nurse Amy.
Well, I came from working at the hospital here, and I'd had 2 years of med-surg and 2 years of ICU, and I was working during the COVID time. I learned a lot and I saw a lot, and I saw the importance of preventative care. I think that would have been a very key aspect of reducing the strain that nurses saw, or just, well, all health staff saw during that time. And so when this opportunity came up, it was just an incredible ability to join this team.
What about you, Nurse Haley?
Well, I'm not really sure how my life guided me in this direction, but I've always cared for individuals and of all walks of life, and I don't know, I think nursing was just part of my personality from an early age, and so it was kind of, I guess, just who I was. And I came to public health for a very similar reason. I believe in promoting, preventing, and educating the public. And I also have a background from the hospital. And I think it was very important to spend time with individuals and gauge what their needs were. Also, I am a Valparaiso native, born and raised, and I continue to raise my family here, so this community is very, very important to me, and being able to give back to a community that has given me so much was very important.
What about you, Nurse Shannon?
So I spent the majority of my nursing years in hospice. I was there for 21 years. And so when I found myself in a position of wanting and needing to find something different, I kind of focused on public health just because for so long I had taken care of patients and been in that area of nursing where people don't get better. Which I really love, honestly. I do like serving that population, but just the idea of doing something completely different where we're focused, our patients are not sick just yet, and so being able to focus on patients that aren't sick, and like the other two girls said, prevention and education was just something that appealed to me because it was something I had not done before. And so that was, and like Haley, I grew up here, my husband grew up here, and I utilized the health department when I was a kid. I utilized it for my children, and so to be able to be a part of that is pretty cool.
Awesome. So 2 of you ladies have experience at a hospital. You mentioned that you have experience with hospice. Mm-hmm. So how does being a public health nurse differ from working in a hospital or some other kind of private health setting? Shannon?
Well, definitely, like I mentioned, in the hospital, your patients are already sick. And so you're working more to find a cure. You're trying to get them better. Sometimes that goes great and other times it doesn't go so great, but you're in that acute care setting. Whereas in public health, we're meeting our patients before they technically become patients. Mm-hmm. So providing that education on ways to keep healthy and ways to, promote your health and protect your health rather than trying to, come up with that cure for that disease is a lot different from, the patients you see in a hospital.
You ladies have anything to add to that? Like you said, you came from a hospital, so is there anything you want to add to that?
I think following directly my beliefs align with Shannon's. The only thing that I would add to that is the education portion of that. Mm-hmm. It sounds easy to educate an individual, and we do the best to find the most recent resources from the most reliable sources. We are a judgment-free zone. Our biggest belief at the health department here is to give people accurate information so they can choose the best decision for their health. And, I think that's one of the most important roles that we play. We want to make sure that people take charge of their own health, and we're just here to guide them along that journey.
Anything to top off that off, man?
I would say it gave me an appreciation for the framework that spans from county, local to state, international, and global defenses that we have against communicable infections that can spread, or allowing people to break through those barriers to engage in aspects of just enjoying life on this little blue planet. Whereas in the hospital, it's a very reactive version of healthcare, and bless the people who are there doing what they do. But this is my ability to just try to help reduce their workload. And it's always joyous to see.
I appreciate that insight. Would you say that being a nurse, working in healthcare in general, would you say that's more of a calling? I feel like there are a lot of jobs out there that, you go to college for and you're just kind of working in a career. I kind of find that people that work in healthcare, doctors, nurses, this is something that they've wanted to do ever since they were yay high. Would that be the same scenario for you three ladies?
I think so for me. I remember in high school at some point taking a quiz of some sort in, homeroom or something, where they kind of tried to direct you where they thought your personality fit career-wise. Mm-hmm. And mine was definitely healthcare related, and I was already thinking along that line anyway. But yeah, I definitely feel like this would be my calling, and specifically even with the hospice nursing and the public health nursing. Like I feel like different nurses fit in different roles within nursing itself, so I definitely feel like it would be my personality. And I think you have to have, there's certainly different types of personalities that go along with different types of nursing. Like I said, a hospice nurse is a lot different from an ICU nurse that's always, on alert and, but it all I think comes down to still having compassion for people. And to me, I feel like that's generalized throughout every nurse, I feel like.
What about you, Nurse Haley? Were you that little girl that was going around putting bandages on all of her toys and maybe other siblings and whatnot?
I don't know if my younger brother would have said that, but yes, I definitely think it is a characteristic that an individual carries with them. Caring for others and understanding pain and joy, and a lot of emotional intelligence goes into our career path. Understanding what individuals go through can be difficult, and being empathetic to that, and just doing the best that we can to help navigate people through either crises or beautiful parts of life, but it's all encompassing. Yes.
Mm-hmm. Anything to add, Nurse Amy?
Piggybacking off the concept of just you have that spark of compassion that you carry with you through your life. I had the opposite experience. I grew up, I had no idea what I wanted to do, but I wanted to do all the things. I wanted to go work at Pixar, and then I wanted to be the next Ducky from NCIS. So all kinds of different things. But when I became a patient and I was being taken care of, and I saw just how much compassion this nurse had for me, it was actually my mom. I said, well, gosh, I want to do that for somebody else. And now I get to.
Yeah, that is awesome. So we talked a little bit about how all of you have your own respective roles, but you do share some responsibilities. Can we talk a little bit about what a typical day for all of you is like at the health department? Can we start with you, Amy? Just what's a typical day like for you?
Unpredictable. And that's what's so nice about it. Is one day, personally, I could be giving routine shots to kiddos or someone who's getting ready to go off on an amazing international tour. Next day, I could be going to the juvenile detention center here and giving them education on safe sex practices, and seeing that spark and that hunger for knowledge light in their eyes. You just never know what you're going to do. But you're helping your community, and it's fantastic.
So no 2 days are the same?
No, you'll never be bored. If you are, you're not doing something right.
What about you, ladies? Same thing?
Yeah, so we run our clinic. So typically 2 of us will be assigned to clinic duty, which could be child immunizations, adult immunizations, travel vaccines, TB testing, STI testing. So even though Amy's the STI coordinator, we're all able to test and treat our patients. She just kind of coordinates all of that. We all kind of rotate in clinic, and then the days that we're not in clinic, we're working on our respective programs or doing outreach, things like that. So.
Do you feel like that makes a workflow better? Since 2 days are alike, there's always something to kind of keep you engaged.
Oh, absolutely, yeah.
Fair to say.
I love it because it always challenges us to learn and grow with the needs that our community evolves around.
Understood. Good point. So public health nurses, you guys often do a lot of things behind the scenes, things that people don't get to see up front. Nurse Haley, what do you wish people would know more about the work that you do behind the scenes?
I think that a lot of people have the understanding or impression that we only give immunizations. We do so much more than that. We are here to help our community in so many ways. Besides nursing specifically, we help to coordinate care with individuals. So trying to find a provider, trying to find a need, anything that individual or family may need, we try to provide. Resources within our community. We have a great networking system with other community partners, and we work together to give our community this beautiful life.
Absolutely. Nurse Shannon, what are some of the most rewarding parts of the job of being a public health nurse, you think?
I think there's a couple, but I think that one of them is when you see kiddos come in for their very first set of shots at 2 months old, and then you follow them through. It feels, I think, to parents like they're there every other week getting shots, because you do get a lot at the beginning, but just seeing those kids grow up, and then eventually you see them go to school and things like that. Knowing that you played a role in keeping those kids healthy, and and just again providing them with whatever it is they may need. We do provide a lot of resources to new parents, educational materials and things like that too. So I think just seeing those families go from the very early stages to just thriving, and that's pretty rewarding.
What about you, Nurse Amy? What's a rewarding part of this job for you?
It's twofold. So first would be seeing the fear that people come in when they are experiencing probably a really rough time in their life, and they want to get evaluated, tested, see what's going on down under, basically. And seeing that fear, knowing that they're in a safe place, they're being taken care of, it's professional but also compassionate. And then they say to me, "Thank you so much for making me feel safe. I'm going to come back." And then the other fold is when they do.
Nurse Haley, anything to add on that?
Honestly, I love caring for people in all walks of their life. We see moms that are pregnant. We see newborns. We see infants, toddlers, teenagers, high schoolers, those going off to college, those traveling, middle life, and end of life. And it's beautiful to see all of the different walks of life walk into our health department, and we can care for all of those individuals and their needs.
A very diverse patient base, if you will.
Absolutely.
Absolutely. So on the flip side of that, we talked about what's rewarding. Let's talk a little bit about the challenges that you face. Start with you, Nurse Amy. What are some of the challenges that you face as a public health nurse?
Well, I love scrolling through TikToks and seeing the cute videos, social media and news, all the voices that people can listen to. It's hard to combat what they hear, what they want to hear. So I just have to always present what I know is evidence-based practice and just tell them, hey, I'm not here to push any kind of agenda. I'm just here to offer you my resources. Here's where I'm coming from. What can I do that you would like me to do and help you? That's all I want to do.
Address some of that misinformation, if you will.
Yeah. Because I just want you safe, regardless of what's on your mind today.
It's the overall goal, right?
Yeah, it's your body, your choice.
What about you, Nurse Shannon?
I agree completely with Amy. I think she said it really well. It's hard when you're up against what everybody sees and everybody hears, and There's just so many different sources out there that aren't credible, and so you get a lot of backlash when you're trying to do what you know is right, based on, like she said, evidence-based practice, what we do our research and what we follow. But yeah, just, again, presenting them with the information and letting them make that choice for themselves. That's really all you can do.
Understood. Anything to add, Nurse Haley?
I believe my counterparts just nailed that one right on the head.
Gotcha. No problem. Let's move on to the next segment, if you don't mind. So, like we talked about at the beginning of the show, this week is National Nurses Week. It's a time to honor the profession, your profession. What comes to mind as we gear up to honor nurses for this week ahead? We'll start with you, Ms. Shannon.
Well, honoring nurses, I feel like, we put a lot out there for our patients. We kind of sacrifice ourselves. We sacrifice time with our families. And I feel like by honoring nurses would be just showing appreciation for the amount of time and the effort, the education, the schooling, everything that we give, that we pour into our patients every day.
Nursing's not easy.
Nope.
Nursing ain't easy. So, Nurse Haley, what advice would you give to the youngsters, the people that want to follow in your shoes to maybe one day become a nurse, whether it's in public health, a hospital, any of the ways that you could become a nurse? What advice would you give to the youngsters coming up to be more like you, I guess?
Oh, goodness. I tell, we have a wonderful cohort of nursing students that filter in and out of our facility, just to give them a general idea of different types of nursing. And I tell all of them this, so I apologize if you've heard me on my soapbox before. Number one, be passionate about what you do, whatever that is. Find your passion. Nursing is so diverse that if maybe you didn't find your niche just yet, it may be around the corner, but always do what you are passionate about. Number two, and this is very hard, as we spoke earlier, nursing, yes, is what we do, and it can be a characteristic of our personality, but it is your occupation, and as I guess one of our work hazards here as being a nurse is that we care so much for other individuals, we forget to care about ourselves. So don't neglect yourself. Remember that you do punch in and punch out at some time. So self-care is number one, and definitely follow what you're passionate about.
Nurse Amy, is it hard to turn that nursing knob off once you clock out? Or?
Oh, yeah. Just like she said, it can be hard to remind yourself that your patients and your own emotions all matter. And you cannot give from an empty cup. You have to fill it up yourself, and then you can give to others.
That was well put. How important is mentorship in this field? Do you ladies have someone who mentors you or inspired you early on? Let's start with you, Nurse Amy.
Harkening back to my own mom, actually, I'm third generation of nursing.
Wow.
And actually, my mom's an ICU nurse, my dad's an ER nurse, and they both took bets, and they both won and they both lost as to where I went. So, but yeah, just growing up in that kind of a field and seeing what you can do, even when you're not clocked in, just always having these skills at the ready, is just so empowering.
Well, can we talk a little bit about the skills and qualities that will make someone a good, well-suited nurse in a public health industry? Let's start with you, Nurse Haley, because you did touch on this a little bit. Talk a little bit about the skills or qualities that make a good nurse.
I think the first one by far is knowing that you're not going to know it all. The next thing to align with that is knowing who to go to or where to go to get accurate information. I think nursing and healthcare in general is constantly evolving. We're always looking to see what is best practice for individuals. And so following those guidelines and evidence-based practice to make the most accurate decisions for each individual and what is best suited for their lifestyle is most certainly probably the top priority, and no matter what setting you're in.
What about you, Nurse Shannon? Anything you can add on top of that?
I completely agree with Haley. I think also, obviously being compassionate, but also being organized, having good time management. Those are all things that'll set you up for success. I think that's some important qualities of any nurse, is being able to prioritize and manage your time well.
Understood. Nurse Amy, anything to add?
Remembering, just like what Haley said earlier, is you clock in, you clock out. There's only so much time you can do, only so much. And in that time, as long as you keep this core belief that, I'm going to date myself from one of my favorite movies, Patch Adams. You treat a disease, you win or you lose. But if you treat a person, I guarantee you're going to win every time. If that's your focus as a nurse or any aspect of healthcare, you're always going to win.
Gotcha. I must admit I haven't seen that movie.
So good. Not inaccurate, but so good.
Is it a healthcare movie? Or?
Well, it's not a family-friendly healthcare movie, but based on a true story.
All right, then. Moving on. So let's talk a little bit about building and maintaining trust in the community. I mean, we are working in public health after all. Start with you, Nurse Shannon. How do you build trust with the community that you serve, especially amongst those who may be hesitant for checkups, vaccines, other services? There's actually a term from this that I learned a few days ago, thanks to one of our awesome nurses. White coat syndrome?
I think first and foremost is creating a judgment-free zone. Like, this patient comes in and maybe it's a mom who's been hesitant to get her child vaccinated, and so they may be entering school age and they haven't had any vaccines. And so, now they're coming in, they're open to it now. So not judging her, not making her feel like her decisions were wrong, or, but just supporting her in those choices that she's making, and just providing information on, why we vaccinate, what we vaccinate for, and why at these certain intervals. I think that helps to create trust with people. Could be the same thing. Maybe someone comes in, they've engaged in some maybe risky behavior. They may be a little embarrassed, but just like keeping that communication open and just making them feel like it's a safe place. I'm not going to judge you based on, any information that you're giving me at all. My job is just, like Haley mentioned earlier, present you with the facts, and I think Amy mentioned this as well, and just, this is what we're here to do, and then you make the choice. If this is best for you, then this is what we're going to do, and if it's not, then it's okay. We'll be here when you come back.
Okay. What about you, Nurse Haley? Is there anything you can add on that with the white coat syndrome that I just learned about?
No, I definitely think Shannon had a fantastic answer. I don't really know how to follow that up. I would just say we are a judgment-free zone. There is no pressure whatsoever. You can call us and ask whatever question. No question is not a good one. We, again, are just trying to provide the most accurate information for each individual, and let that individual decide what is best for them and how they want to live their life.
Anything to add, Nurse Amy?
I like to defeat white coat syndrome by making my patients see that we're all people. Yes, I'm wearing a scrub uniform, but I'm the biggest dork, and if I can get you to laugh, then you can at least see I'm a person. I'm not out to get you. I'm here to help you. I got the tools, and you were brave enough to come in, and I just really want to be there for you. So if they can see that connection, I feel like half the battle's already won.
It's all about the connection, right?
Yes.
Okay, ladies. So, are there any stories or moments that stick to mind? Perhaps a time when you saw real change in somebody's health journey because of our team's outreach or some services that we provided? Do you guys have any success stories that you can share?
So I had contacted this patient. She was positive for hepatitis C, which is kind of has a negative feel, when people, are diagnosed with that. And so...
Yeah, I'm just listening.
Oh, okay. I thought you were like...
No.
Okay, I'm sorry.
No.
It's okay.
Okay. All right, so I contacted this patient. She had tested positive for hepatitis C, which sometimes gets a negative connotation from people. And so it's not easy to talk about. That's something that, sometimes people get if they're involved in more risky behaviors, and so it's not easy for patients, and they don't always want to give a lot of information. But this lady was very forthcoming with everything. She definitely wanted to get treated. She wanted to get better, and so there were certain vaccines that I was able to recommend for her that she came in to get from me that next week. So I felt good about that. I was able to connect her with care so that she was able to get her disease treated. Not everyone is so open to treatment and the education that I call them about, but this lady was, and so it was just, it did good for me just to see a positive outcome from something that I did. So.
Just to show that your work is having a positive impact on the Porter County community.
Yep.
Totally understand that.
Mm-hmm.
I'd like to ask another question. What is your favorite part about your job, ladies? Whether it's seeing patients, the outreach initiatives, we do a lot of things outside of our brick and mortar. We're pretty active in the community. So we'll start with you, Nurse Amy. What would you say your favorite part about the job is? Is it meeting new people, getting out and about in the community? What makes you want to come into work every day?
It's definitely the connections that I would not have had in the hospital. Because again, that is incredible work, but it's reactive. And oftentimes you're seeing people on days they don't want to hear about how to, eat better or what vaccines they need to get updated on, blah, blah, blah. So when I'm in the office, I get to meet with people who are motivated in some way to learn about their body. They want to do something good for themselves. And I love seeing that, like I said, that light in their eyes when they get that bit of knowledge and they say, I'm going to go do some research of my own. I'm going to start this new lifestyle choice. It's just so cool seeing who's going to walk in and take that spark with them when they leave.
What about you, Nurse Haley? I heard you love riding around in our awesome mobile clinic.
It's my favorite part of the job.
Don't you love driving it too?
My husband doesn't let me drive anywhere. I absolutely love everything that I do. I have truly found my calling and joy in my life. And that suits me best. Being a public servant and helping the community, we look at all individuals from the beginning of their life to the end, and we encompass so much of that. We are not just here for preventative care. We're here for resources, connections, and all of the things in between. So watching that unfold and see how our community comes together to help everyone within it is really beautiful.
Nurse Shannon, what's your favorite part?
I do like getting out in the community. It gives us something different to do than just the four walls of our office every day. But yeah, getting out, going to the nursing homes to provide vaccines there, going to the schools for vaccine clinics there, or even just taking the mobile unit out and having people come and utilize our services where they are. Not everyone can get to us, so I think it's great that we get out and meet them where they are, wherever that might be. So.
And it's awesome, the mobile clinic that we have, we can bring the services to people and they don't necessarily have to come and pay us a visit. We can meet them where they are in the community. Mm-hmm. Absolutely. Let's move on to something a little more fun. So last year we had our first ever, our inaugural summer kickoff to Health and Wellness Family Fun Fair at Central Park Plaza, home of the Northwest Health Amphitheater. And we're bringing it back for year 2 on June 13th. That is a Friday at Central Park Plaza. Once again, we'll be under the pavilion. We'll be out there on the lawn. The splash pads will be going again. We're going to have another big party. You ladies all attended last year. You were a part of the party and the festivities and all that stuff. That's right. That's right. Can you ladies talk a little bit about what year 1 was like for you and how big of an impact that you think it made on the community? We'll start with you, Nurse Amy.
You're saying year 1 for the party or
for the health fair?
Oh gosh,
yeah, from last year. Mm-hmm.
What was great was we had a guesstimate of how many people would come, and the reality smashed through it.
Yes.
And the enthusiasm that people were bringing. It wasn't just like parents bringing their kiddos to the splash pad and going, oh, what's over here? It was, hey, I actually need the kid to get haircuts and the sports screens because he's going into soccer and she's going into swimming. And getting all of their stuff done in one day. So cool.
We were expecting anywhere between 200 to 400 people, and we saw nearly 1,000 last year. I think the splash pad had a big effect on that. It was real hot out there.
Oh, yeah. But hey, that with the DJ and the food, who can say no?
What was your favorite part about last year, Nurse Haley?
Honestly, this is what we're all about. We are all about getting our community together and providing those services. And, so to do it in a fun way that's very interactive with children and families of all ages. We had high schoolers out there dancing to the DJ. We had little kids running around in the splash pad, coming up and getting a bike helmet. You name it, we did it. The amount of haircuts that were done, dental exams, vision screenings, heart screenings for children, physicals, all of those important things that, let's face it, us busy families, you try and get around to it, but to have it all in one central location that your community is providing you for free, you couldn't beat it. And it was a fun experience for everyone. So we had a blast last year. We're looking forward to it this year. I don't know who's more excited, if it's the public or the nurses, because we get a day out in the sun with everyone too, but we are certainly counting down the days.
Well, Nurse Shannon, we talked a little bit about what went on last year. What are you most excited about the fairs coming up for this year?
Well, I will love to see if we can meet the excitement and the numbers that we had last year, because it certainly was huge. Such a great turnout. I love seeing the little kids come through. I remember just being a mom of little kids, and you're on those long summer days and you're looking for something to do, and so if something like this pops up, it's great. It not only meets the need for the services that you can get while you're there, but the kids have a ton of fun too, playing games and getting little prizes from all the different booths and everything. So just seeing the families having a good time takes me back.
Nurse Haley mentioned that there was a little bit of some dancing and a dance party going on. I think we've got some pictures on our Facebook of our nurses getting down, actually. I think you guys were doing a Cupid Shuffle, I believe.
We had a good time. We're looking forward to it this year.
Oh, yeah. We'll get those old pictures up there on our Facebook here in the next few days to let you guys see all the fun that we had last year and all the fun that you can expect to have coming up on Friday, June 13th of this year. Nurse Haley, you talked a little bit about this, but I want to move this to Nurse Amy. How does this event reflect the mission and the goals of our nursing division here at the health department? Kind of like we said, kind of like Nurse Haley said, all those services under one location, so to speak. Can you talk a little bit about that and the benefits of that?
Well, yeah. First, we I don't want to say entice, but we show that healthcare can be fun. But, and you look past the DJs, you look past me in a SpongeBob costume, which I'm excited about. I heard I'm maybe going to be a specific primary colored dog this year.
Is SpongeBob coming back? Is SpongeBob coming back for the fair?
SpongeBob might be coming back, or it might be a certain Australian pupper dog. Who knows? But either way, we try to show that healthcare can be fun. It's not a punishment. It's not a chore. It can be a delight to go for a bike ride and see yourself get faster each day, or to learn a new food you can try that's actually good for you and the waistline. So it's just nice to show them from a young age that this can happen and that your community cares that you embrace your health.
Absolutely. Anything else you ladies want to add about their upcoming health fair coming up in June? I think we kind of touched on everything. It's going to be another big party. We'll talk a little bit about that as we close the show. But let's move on to our last section, if you don't mind. Let's talk a little bit about the future of public health and public health nursing. Where do you see the role of public health nurses headed in the next 5 or 10 years? Just, your presence within the community, all the services that you guys offer. Do you see this role kind of getting more important as we go on into the future, public health nursing?
I see it as it's both going anywhere and staying exactly where it's at. Because who knows what's going to come our way. All I know is we're going to be here for you, Porter County, no matter what. Doing our best to help keep you going forward.
That sounds good. Ladies, if there is one thing that you could tell every Porter County resident, one thing about the health department, what it is that you do, something that you think they should know about your job and know about you as a person, what would you say to them? Something that they should know, just, about your everyday role and just the importance that public health plays to the community.
we're more than just a place to come get vaccines. I think a lot of people think that that's what the health department is, and that's a big part of it, but there's a lot that goes on behind the scenes. When you consider Porter County as a whole, we're responsible for surveying and keeping our entire community healthy. And so it's more than just vaccines. We, focus on food safety. We do environmental safety. And then of course all the health aspects as well. So I think it's more than what people see from the outside. A lot of behind the scenes, making connections for different resources and things, whatever the person might need, is trying to get them hooked up with that. So there's a lot that goes on that I think the general public doesn't see unless you're one of those people that's in need of those resources. But just trying to get the word out. We're a huge hub of information, and just encouraging people to look to us, give us a call. If we don't know where you can get hooked up with something, we will find out. So.
Okay. Absolutely. Do ladies have anything to add to that? No? That sounds good.
Yeah.
Nurse Shannon said it all. Well, Nurse Shannon, Nurse Haley, Nurse Amy, I would like to thank all of you for your time today. I think it was really important for you guys to come on here on the PoCo Wellness Hour just to kind of give a spotlight on the role of public health and the role that public health nurses play within that. Like I said, this is your week coming up, so I hope they do some good things for you around the office. I hope you get all the cupcakes and all the cool celebrations and all that kind of stuff, because you ladies certainly deserve it. So thank you so much for your time today.
Thank you.
And once again, speaking of our June Health Fair, that is going to be on Friday, June 13th from 11 a.m. to 3 p.m. This is the second edition of our summer kickoff, the Health and Wellness Family Fun Fair. It's going to be at Central Park Plaza in Valparaiso, once again hosted by the Porter County Health Department. This is a free event back for its second year. We're going to have vision and dental screenings, immunizations, sports physicals, heart screenings, free haircuts, a bunch of giveaways. We're going to have face painting. I can't wait for that. And we're going to have so much more. This is the perfect way to kick off your summer happy, healthy, and ready to go. That's Friday, June 13th from 11 a.m. to 3 p.m. at Central Park Plaza. We hope to see you there. And as we close out the show, we want to thank you for listening to yet another edition of the PoCo Wellness Hour. For more information on the upcoming events and programs and initiatives that we're a part of, you can visit us on our websites. You can go to the Porter County government website, which is www.portercountyin.gov, or you can go straight to our health department website, which is www.in.gov/localhealth/Porter County. And of course, you can find us on social media. You can find us on x.com/county_Porter. You can find us on Facebook, facebook.com/Porter County Health Department. And you can find us on Instagram at Porter_County HD. Once again, my name is Demetrius Lewis, Communications Manager for the Porter County Health Department, and we want to thank you for listening to yet another edition of the PoCo Wellness Hour right here on WVLP 103.1 FM, your show for health, community connection, and overall well-being. Have a healthy and safe, wonderful weekend, Porter County. Peace.